what you hear from primary care providers, you have all these patients with fatigue, overweight, diabetes, and they feel the fatigue, they feel the brain fog and low sex drive from OB providers, especially in our patients that are going through perimenopause or postmenopause. Well, try to do exercise, Dylan says 30 minutes aerobic 3 times a week or 5 times a week. But if their testosterone is super low, there's no way they're gonna follow those instructions. If you're not trained on hormone replacement, you're gonna get from those medical providers that type of answer that it's normal for you to feel like that. You're 40, you're 50, you're 60, it's part of life. So, like about 5 years ago, I started doing some research about hormone replacement and how testosterone itself can help females, males, and as soon as you start that replacement of testosterone, you see the difference. They're back on track. They go to the gym. They sleep better. If you come with me and you're 45 years old and you weigh 220 pounds and your blood pressure is 150/90, and I give you losartan 50 milligrams, and then there is another 90-year-old patient that comes with the same blood pressure and he weighs 100 pounds, guess what? The losartan dose for blood pressure is going to be the same dose. Hormone replacement is not like that. Each one gets their own dose based on the height, based on their weight, based on the testosterone levels, TSH levels. The doses are different. It depends on each individual, each patient. It's not like a generalized dose for everyone. I would say 90% of my patients, they come back to repel it. Males, they usually come every 6 months. Females, they usually come every 3, 4, 5 months. It's a life-changing. If you're my age, 49, and like I love to play soccer, you know what I mean? Go to the gym and see patients, and for the last 5 years, your energy is low, and suddenly you start getting that energy back, and those brain fog's gone. And it will make you healthier. With those testosterone normal again, then you're gonna go to the gym, you're gonna exercise more, you're gonna sleep better, and everything's for your good health.